other RSVPs. So if we want to give it just like maybe one more minute before we get started, Michael? Fantastic.
Sure. Yeah. Okay, I think we'll go ahead and get started. All right, so good afternoon, everyone. My name is Melinda Southard. I'm the Deputy Administrator for Community Supports and Engagement at the Division of Healthcare Financing and Policy, and we'll be opening our presentation for you today. A few quick housekeeping items before we start. We ask that you kindly please take a moment to just drop into the chat a note with your name, your tribal affiliation, and email address, if you could, please. Another quick note is that this meeting is being recorded, and a copy of the recording will be available on the Division's Market Stabilization Program website shortly. We will also send out a copy of this recording to our tribal partners for their review. I would now like to formally open the tribal consultation related to the Nevada Battle-Born State Plans and the Market Stabilization Program. Joining me today in presenting will be Michael Gordon, the Division's Waiver and Stakeholder Director, and our Division Administrator, Stacy Weeks. Also just wanted to say thank you all for being here with us today. As we go through the presentation for the state's 1332 waiver application, you will note that we do have a set time frame of 30 days for formal public comments. You will also have an opportunity to provide public comments today during the meeting, but we just ask that you please hold all comments or questions until the public comment portion of the presentation. And with that, we'll go ahead and get started. So if you could go to the next slide, please. The division will be hosting 2 tribal consultations to engage Nevada's tribal community on the state's 1332 waiver application. One of those is today, and the first one was actually held on November 29th. Per state law, the state's 1332 waiver application must be submitted to the federal government for approval no later than January 1st of 2024. This waiver seeks federal approval for Nevada to receive the savings to the federal government from Nevada's implementation of new state contracted health insurance options and a reinsurance program to both establish and finance a market stabilization program. Today, we will be providing an overview of the Battle-Born state plans and the market stabilization program, provide an opportunity for questions and public comment, and then give an overview on the next steps in the state's waiver application process. Next slide, please. The same state law requiring Nevada to submit the 1332 waiver application also requires the director of the Department of Health and Human Services to contract with health carriers to offer a new health insurance options. These options will be referred to as the Battle-Born State Plans, or BBSPs. Monica, could you move it to the next slide? Thank you. These new health insurance options of the BBSPs must be available to consumers who shop for health insurance in the state's health insurance exchange, otherwise known as the Nevada Health Link, beginning January 1st of 2026. The Battle-Born state plan options will, for the most part, mirror other plans in the Nevada Health Link, with one exception. The BBSPs must meet an annual premium reduction target and pay their provider networks rates that are at or above Medicare rates. And with that, I will hand it off to Michael Gordon to give an overview of the market stabilization program.
Okay, thank you, Melinda. Okay, to continue on what Melinda was explaining, the second key initiative is the Market Stabilization Program. The BBSPs will save federal government funds, which can can be set okay, sorry, we had an extra line in there. So the BPSPs will save federal government funds, which can be sent back to the state as pass-through funding. This pass-through funding would be used to establish them MSPs. I think I have a different copy here. Sorry, Monica. The key goals of the program are to, 1, mitigate the financial risks of the new premium reduction targets on health carriers and their provider networks. 2, to reward health carriers and the provider networks for efforts to improve health outcomes and qualities. And 3, to ensure greater stability in Nevada's individual health insurance market with the introduction of the new health insurance option and reforms. Next slide. As part of this, the governor has outlined 3 potential new initiatives for the market stabilization program. 1 is a state-based reinsurance program at no cost to the state that is aimed at alleviating any unexpected financial risks to participating carriers and the provider networks and the introduction of the BBSPs. 2 is a quality incentive payment program to reward high-performing health carriers and the provider network. And 3 is a practice in Nevada program to provide incentive more providers to live and practice in Nevada, especially in rural regions of the state. These programs, if approved, would begin in plan year 2027 after the state receives its first full year of federal savings under the waiver from plan year 2026. And state law requires the director to contract with health carriers to offer new battle-born state plans and the use of the director's Medicaid contracting authority to enforce certain state requirements. And these are: offer these new plans to the Nevada Health Link and meet all federal and state standards for qualified health plans under the Affordable Care Act. Offer at least 1 silver and 1 gold battle-born state plan. Offer plans that will meet certain premium reduction targets, which will increase gradually to at least 15% over the first 4 years. And last, pay provider rates that are no lower than Medicare rates. And I will hand it over to our administrator, Stacy.
Thank you, Michael. Good afternoon. So the new procurement process under state law directs the director to establish a joint procurement process with Medicaid. And this essentially creates a new joint model for procurement, but also a state private model for operating these new health plans in the individual market. This procurement must take place at the same time as our next state Medicaid managed care procurement, which is slated at this time to begin in 2025, and it'll take us about a year to go through that process. Any health carriers seeking to participate in our state Medicaid managed care program must submit in good faith a bid to also contract with the state to offer and administer the battle-born plans. The division will use the contract as its enforcement tool for the statutory requirements for the battle-born plans, similar to how the state uses its Medicaid managed care contracts to enforce requirements of Medicaid. Currently, the division contracts with 4 health carriers for its program, Medicaid managed care program: Anthem, Health Plan of Nevada, Silver Summit, and Molina. All 4 are national carriers. Health Plan of Nevada is United Health Group, and Silver Summit is Centene. Next slide, please. This slide is a visual for the design of the battle-born plan. The intent is to really lay out and try to explain how this plan kind of compares to other non-group individual market plans. When I talk about non-group individual market plan, I'm talking about those products where someone buys their own healthcare coverage on the market. So they go out and shop and look for coverage. They're not on Medicaid, for example, or an employer plan. They're actually looking actively for health insurance. On the far left side are the basic requirements for any non-group individual market plan. They have to meet state network adequacy requirements for providers. They have to meet all state solvency requirements for the carriers. So, for example, we do not want to contract or have a plan in our market where they offer rates that they can't pay, and they can't pay for the healthcare claims, right? So we want to make sure that they're solvent. State rate review process, and this is where the state reviews the premium rates that the plans will offer for a contract or a calendar plan year and approves them for offering. And also this is where, again, where someone may just reach out, go to the plan's website and purchase coverage directly from the plan. The second set of rules that applies to non-group plans is really comes up when someone wants to shop for a plan through our state health insurance exchange, known as Nevada Health Link. And when folks do that, they're going to actually be purchasing a non-group individual market plan, but it's called under federal law a qualified health plan. So we have that labeled here as a QHP. The QHPs have additional, more stringent standards than ones that you would get, for plans off exchange. And also they have available tax credits. So there is a benefit for someone who shops in the exchange. And also for tribal members, there's also, cost sharing, other benefits for members, American Indians that go through the exchange, other like cost subsidies. So the ACA standards apply here, and all the consumer protections they have to meet. They have to be certified by our exchange. They have to be offered according to certain metal levels. You might have heard of them: bronze, silver, gold, and platinum. That's really telling you how much of the cost out of pocket you'll have to pay. And each plan has a different actuarial value, essentially. This is, again, where someone will purchase the product through the exchange. The Battle-Born plan are going to be a non-group plan, and they'll also be a QHP, but they'll have an additional set of requirements that we enforce as Medicaid through our new contracts with them. That will be the premium reduction target, the minimum provider rate floor, which they can pay no lower than Medicare. Also any other contract requirements that we put in there around quality, any additional network things that we wanted to consider in the future. And they at least have to have a silver and a gold tier. We are also going to be incentivizing a bronze. And again, they can purchase it either on the exchange and get tax credits, or they can go off the exchange and directly purchase it without tax credits, if depending on their income, directly from the carrier. Next slide, please. There are a couple other requirements we wanted to talk about today to make sure you're aware that the Battle-Born plans, the carriers that offer these plans that will be applying, and any of the, especially toward when it comes to providers that participate. So a provider currently who serves Medicaid or basically any of our public coverage programs, so Medicaid, our provider employee benefit network, if they're in that, or they're in our state workers' comp program as a provider, they also must agree to participate in network as a provider in at least one network with one of the state's Battle-Born plans. These providers must also apply the same policies to accept new patients enrolled in Battle-Born plan to the same extent as the provider accepts new patients not enrolled in a Battle-Born plan. Essentially, this is trying to ensure there's no discrimination for these individuals that buy a Battle-Born plan. State law also requires the director to promote in its contracting process certain strategies with health carriers that will better align our networks between Medicaid and individual market. So when someone is moving out of Medicaid, in other words, moving out of poverty, they will be able to hopefully keep their provider in the individual market depending on alignment in the network, address certain health disparities in the individual market, improve cultural competency in our provider workforce, increase the use of value-based payment models with our providers, and address the gaps in Nevada's healthcare workforce. Next slide, please. So in order to implement the Battle-Born plans, the premium target, and the reinsurance program, the state must seek a 1332 waiver application under our state law. It directs the director to do this. As part of that waiver, we have an actuarial study, and that's a federal requirement. And according to that study, the waiver is expected to lower premiums and generate savings for the federal government. This is because in our exchange today, the federal government buys down the cost of premiums through what is also called advanced premium tax credits. So the consumer, does not necessarily see that cost because depending on your income level, you should be eligible for these tax credits. So if we lower premiums, the federal government has to spend less and buying down premiums. So the goal of the waiver and what the waiver allows us to do is capture that savings. And we're going to bring that savings back to Nevada, and it's going to be used under the new governor's market stability program. The 1332 waiver is expected to achieve a savings of about $279 million in federal money, which we would get back over the first 5 years, and $760 million at the end of the first 10 years. And on the side there, the bubble box is intended to show you where we're at in the process. We are currently in stage 3 of 7. We will be submitting the waiver January 1, and Michael will talk a little bit about that in a minute. There will also be another federal comment period as well for people to also give more feedback at that time. Next slide, please. All right, turn over to Michael. Thank you.
Or actually, Monica is going to help us out
Monica,
today. So
my
thank
apologies.
you, Monica.
Thank
That's
you.
okay. Thank you so much, Stacy and Michael. So what the impact to tribal communities and your recipients would be is that the mandated premium reductions will reduce premiums for any of our recipients that would be purchasing battle-born state plans, including American Indians and Alaska Natives. And according to the 2023 open enrollment file, there were 516 AIAN members currently enrolled in coverage through Nevada Health Link. So the Battle-Born State Plan program will not impact existing protections available to American Indians and Alaska Natives through the Nevada Health Link. Any AIAN who earn less than 300% of the federal poverty level will remain exempt from cost sharing and qualify for premium tax credits. The modified adjusted gross income calculations for AIANs will continue to exclude some revenues that are earned on reservations from federal trust payments. And AIANs may still change the QHPs once a month without worrying about open enrollment dates. So the Battle-Born State Plan will not impact existing financial assistance provided under DHCFP or Nevada Medicaid, in which AIANs eligible for Medicaid do not pay premiums and do not have other cost sharing. The Battle-Born State Plans will also not impact healthcare services provided through Indian Health Services, tribal or urban Indian health programs. They will require more robust and aligned networks with Medicaid, including essential community providers. As a reminder, the qualified health plans, which will include the BBSPs, thank you, must include at least 35% of available essential community providers in each plan's service area in the provider network. And they must also offer contracts in good faith to all Indian health service providers. Participating health carriers are also required to pay tribal providers participating in the Battle-Born State Plan networks no lower than what they pay in Medicare. And I will turn that back over to Michael.
And I believe Melinda is going to help us out with public comment again.
Yes.
So
Thank you.
She's great at this. Thank you, Melinda.
Thanks, Michael. All right, now comes the time for public comments, questions, anything that you all would like to raise about the 1332 waiver application. And if you have public comment, please feel free to use the raise hand feature in the Teams platform. I think that all of our participants are using the Teams platform and nobody's calling in. So if you would like to raise public comment, please go ahead and raise your hand.
If I could, Chair Lone Eagle, this is Monica. I just wanted to let you know we'll be sending this recording out as well, just for your information.
Thanks, Monica. Right. Hearing no public comment, I think we will.
Actually,
go ahead and go back to the previous slide. Luke, did you have a comment?
Sorry, find my unmute button here. I was just looking at the part where it says the BBSP requires more robust and aligned networks with Medicaid, including essential community providers. I think in the past when we've been approached as to registering as essential community providers, we have been instructed by our leadership not to do those kind of in-network applications in general. And I don't know if you've spoken with anybody in Indian Health Service as far as how we communicate about, bills and reimbursement without being a network provider?
So this is Stacy Weeks, the administrator. That's a really good point. We haven't. That's why we wanted to have these conversations. I think what I hear you saying is if you're not an essential community provider, right, in our Medicaid program, would that maybe not, this alignment piece that we're going to have require, would that not really help you? And, definitely understand that piece. And so I think what we can do on our end is make sure that we include, at least for the individual market plans, if you're interested in a contract with them, right, we could include that we would require them to work with you guys in good faith to make sure there's access in your community for their provider networks. We could do something around that. Does that help answer your question, or do you have any other thoughts on that?
Yeah, no, I think that hits on it. I would see the scenario where an individual patient that comes here would sign up for one of these plans, would come here, we would try to bill their insurance for services provided, and then when we get the bill out, they might say you're not a network provider, or you're not, an essential community provider. We need you to fill out this paperwork. And we say we don't do that. So
maybe
as
we
long as
just
that's
need to
covered.
exempt you from that piece.
Exactly.
And just make sure you're in network somehow without you having to go through all that paperwork is what I hear.
Yeah. Yeah.
Okay. Thank you.
Thank you.
Hi, folks. This is Angie Wilson, the director for the Reno Sparks Tribal Health Center. Sorry for showing up a little late. I'm just running late from another meeting, so I'm just looking to catch up real quick. Thank you so much.
No problem, Angie. Thank you so much for being here.
Hi, Angie, it's Monica. I'm going to go ahead and send out for those that wanted to be here but had conflicting appointments. I'm going to go ahead and send out the recording as well for everybody.
Okay, great. Thank you, Monica. So real quick, I'm sorry, Stacy, just real quick.
No, you go.
Just a general overview of the Battle-Born State Plan. And I don't want to, hold anybody else up on this meeting. If you just need to hold it to the end and maybe just update me. But in a general sense, the Battle-Born State Plan, can you just give me a general, just quick overview of what it is?
Yeah, no problem, Angie. Good, very good question. Fair question. It's like the unicorn. So I think we did walk through some of this, but I think in a simple, just saying what it's basically today, if you went and bought, your folks that buy their own health insurance, right? So we're not talking about the large group market, the employer coverage. We're not talking about Medicaid. We're talking about mostly what you would think of maybe if your members buy through the exchange. It would be a product that looks just like that, except it's meeting additional requirements and contracting with us for the first time. And really, we're really trying to do what we do in Medicaid in the market is really drive different quality, different arrangements with providers to get better efficiencies, or actually paying them for the outcomes and value, right? So it's a little bit different in that way. And then also and I think the crux of this whole waiver is that they meet a premium reduction target, right? And so instead of the, right now when premiums are set, that the feds buy down those premiums with tax credits, okay, in our exchange, right? And so the premium people actually pay and see and feel is really not the actual premium for a lot of folks if they're eligible for tax credits, right? So for those that are not, those premiums typically are high. So this product, we're asking it to come in at least year one at 3% lower.
Okay. So the Battle-Born Plan is like a new QHP to the Nevada Health Link?
Yeah, essentially. And if people want to buy it off directly from a carrier, they can. Every carrier that plays in Medicaid managed care, so anyone we contract with in our next procurement, right now we have 4 plans. We have United, Centene, Silver Summit, Centene, Molina, and Anthem. So let's say we have those same 4 next year. Each of them would have to offer this certain type of QHP, right? Kind of specialized QHP. At a lower rate. And what we do with this waiver is we're saying to the feds, we saved you money. Let us have that money, and we're going to use it for this, what the governor is proposing, a new market stabilization program, which is reinsurance, which lowers all premiums in the individual market across the board. So it helps keep the burden off the provider a little bit more of this new target. And we're doing a loan repayment program where we would pay for providers to go and live and work, repay all their loans if they'll live and work at least 4 years in a rural community. We could define that as tribal as what, whatever you guys are comfortable with. But that's one of the efforts. And then the other effort is to do a new bonus quality payment program with our carriers in the individual market around certain priorities around health, right? Like maternal health, making sure we're meeting metrics and that they're doing the things that we want to see for the first time in the market. So that is, I think, if that is helpful, I hope I didn't make it too technical, but
No,
that's it in a nutshell.
So I guess that one thing I would just say, I'm just going to jump in here, so I hope that's okay.
Yeah, no, it's all good.
I don't know how many other tribal programs are on or if they've voiced any questions either. So apologies to the other tribes if I'm reiterating any issues that you maybe have already addressed. But I guess the question that I would have is, I just want to make sure, because we've been working so hard on the tribal sponsorship process with Nevada Health Link on the QHPs,
Yes.
So that tribes are allowed under the Affordable Care Act to purchase, to sponsor the premiums for healthcare coverage under the exchange. And that means that we're able to use our federal funding or our third-party revenue to purchase insurance for eligible folks. And that normally is our members who are federally or who are members or enrolled members of federally recognized tribes, not necessarily only Nevada tribes, but any tribe. And so in doing that, we would do that to ensure that the other issue under the Affordable Care Act is that American Indians and Alaska Natives who receive referrals from their tribal health facility, also, those folks can be privy to zero or limited cost sharing provisions. And so we just want to make sure, if this battle-born state plan is an option, and I'm assuming that it's going to be available under the Nevada Health Link, that this too would be a program that we could sponsor for eligible Indians, and that there would be zero or limited cost sharing. And then the other issue that we're always up against, of course, is making sure that the QHPs, including battle-born state plan, offer the model, Indian addendum, which allows battle-born allows the tribes the ability to bill and or contract with, if they so choose, without interruption, because tribes are allowed to have providers from various states, not just licensed in Nevada. And so a lot of tribes do that. We have providers that are licensed in, a multitude of different states. And so we don't want there to be an issue with that. So just kind of, wanted to just reiterate some of the things that we've been working on. Also, one last thing is making sure that the QHP, so for instance, the battle-born state plan, if we were to sponsor those plans, that, we work with you to make sure that the tribes can have aggregate billing. We don't want to have to manage this individually, patient by patient by patient. We need to be able to have a pathway that if we were sponsoring 50 people or 100 people off of the battle-born state plan, that we would be getting an aggregate bill of all of the monthly premiums in one invoicing process. So we've been working with the Nevada Health Link on that, but with the QHP. So I would assume this would offer us the same pathway.
Yes, Angie. So just to answer it probably quickly would be that all the rules and everything that applies to any QHP. So definitely, no matter what, your cost sharing, all those rules in federal law apply here. So nothing changed. It's essentially what you do with any QHP would apply the same here for battle-born, including the sponsorship, whatever you guys work out with Nevada Health Link. So I am familiar with that. I sit on that board. And so I'm very familiar that that's moving forward. That would apply here just like it applies to any QHP. And then the other piece, the Indian addendum. So is, to the extent, I don't know, do you have to negotiate that now today with individual QHP carriers, or is that already a requirement?
Actually, it's actually making its way through you guys overall for all the QHPs. So I'm assuming that.
So whatever, yeah. Yeah, whatever you get there will apply. And we split, I mean, under state law, these products have to meet all QHP standards and requirements and be certified. It's just in addition to that, we get to add bells and whistles, I would guess you could call it, in the contract.
Okay.
Mhm.
And then are these, so I just want to make sure in my mind, it's a separate QHP. It's not a managed care organization, right?
It's so when you think of, let's pick a plan like Molina. They're the carrier. They have a Medicaid managed care program, right, which is separate. But Molina also has an individual market plan, which is a separate program. Same thing here. It won't be Medicaid managed care, but it will be their individual market plan. We're just using our ability to leverage, because these plans altogether, by the time 2026 will roll around, will be worth about $4 billion or more for these carriers. It's a lot of money. So we're leveraging that, money and authority, buying power, I guess, to get them to do something different on the other market, but you're not going to be buying into Medicaid.
Okay, great. Okay, I'm all caught up. Thank you so
Yay,
much.
you're welcome. Okay. Thank you. Great questions.
Thank you.
Wonderful. Any other questions or public comment?
One quick question, sorry.
Sure.
Will the Battleborn State Plan be for eligible services across all of the counties, or like some of the other QHPs are limited to only certain counties?
So in the state law, it says statewide. So the goal would be to have a Battleborn plan. It may not be all carriers or statewide, but we would need to have each rating region covered by some sort of Battleborn plan.
Okay, gotcha. Okay, thank you so much.
Yeah. And also just to mention, sorry, we didn't go over this as much in detail, but in the waiver, there's some explanation around reinsurance that also will get at some of the high premiums in, in some of the rating regions of our state, the premiums are higher, right? And this reinsurance, the way we've structured it, is to try to drive more money into those higher cost areas of the state. It won't equalize it exactly, but it will lower them more to try to get eventually to a state where you don't have really high, higher prices depending on where you live in the state. But it won't be perfect, but that's the goal of the reinsurance program, is to lower across the market, but also to focus geographically where it's needed the most.
All right, and with that, I think we'll go ahead and move on. I think, Michael, you have next steps.
Yep. So I just want to add that any questions will be answered in writing within the next 2 weeks. The division will be accepting written public comments on the state's 1332 waiver application until December 20th, 23. And the waiver application will be submitted to the federal government by January 1st, 2024. Additional materials can be found at our website, Nevada Market Stabilization Program. And the next slide does have some more additional contact information for myself and Monica. So, please feel free to provide any additional comments to either one of our email addresses, and we will get those added into our plan. And I want to thank everyone for joining us in the tribal consultation today. And Stacy, would you like to do any closing comments?
Sure. Just wanted to say thank you all for joining. We know you're very busy. Again, it's recorded, so you can share it. Monica put the link, I think, in the chat. But thanks again for your time. And if you have other questions or comments that you want us to consider, please send it in, like Michael said, by email, or you know how to reach us. And Monica, we're happy to be of assistance and look forward to working with you guys on this. So thank you.
Thanks, everybody. This is Angie from Reno Sparks. I just want to thank all of you for taking the time to, be here today to help present to the tribes. I'm not sure if the other tribes are on, but I will tell you that Reno Sparks Tribal Health Center looks closely at a lot of these things. And, of course, we want to be as innovative and supportive of our own state as possible. And so, I apologize for being late today, but I cannot stress to you the importance of these conversations. And I hope that you all know how greatly we appreciate being included in these discussions. So, this is an exciting thing for the state. It's really cool to see the work happening around this. And we're here to help support in any way that we can. Thank you for taking the time to answer my questions. And I just want to say thank you to all the work happening here. It's something that we're very proud of for sure. So thank you.
Thank you, Angie.
Thank you, Angie.
Thank you.
Thanks, everybody. Bye-bye.
Bye.